Abdominal incision, laparotomy. Cesarean section is the surgical delivery of a baby by an incision through the mother's abdomen and uterus. Some C-sections are planned, for example, when the mother has already had a C-section or is having multiple babies, but many occur if a vaginal delivery is deemed unsafe due to times an unexpected problem during delivery, times maternal health problems, times size or position of the baby, times the baby's health being in danger, times or the labor not progressing as it should. The surgery usually takes about 1 hour. The mother is given spinal or general anesthesia, and then a 6-inch horizontal bikini cut, or occasionally a vertical incision, is made in the abdomen. An incision is then made in the uterus, and both baby and placenta are delivered. The uterus, fascia, and skin are closed with sutures, staples, and/or topical skin adhesives. Dissection. During a C-section, surgeons dissect through multiple layers of tissue to expose the uterus. Following the initial skin incision, the fascia covering the rectus abdominis muscles is opened. The muscles themselves are then gently separated to expose the underlying peritoneum. The peritoneum is opened to access the abdominal cavity. After the skin, fascia, and muscle layers are opened, they are carefully retracted. The uterus is revealed. Hysterotomy, uterine incision. A horizontal incision is then made in the uterus. This incision is known as a hysterotomy. Baby delivery. The baby is delivered through the uterine incision. Placenta delivery. After the baby is delivered, the uterus continues to contract, detaching the placenta from the uterine wall. This spontaneous placental separation usually happens within 5 to 30 minutes of the baby's delivery. Once it has detached, the placenta is removed through the incision. If spontaneous expulsion does not occur, manual extraction may be performed by the surgeon. Uterus closure. The uterus is closed using a continuous suture. Muscle closure. The peritoneum is usually not stitched, but rather left to heal on its own. The rectus fascia is closed using continuous absorbable sutures. The abdominal muscles are allowed to fall back into place naturally. Skin closure. Finally, the skin is sutured together and the procedure is complete.